Our next presenter, a fellow Canadian, Dr. Edith Samuel.
Yes. Yeah, okay. I've changed the title of my piece. It's Effective Treatment Strategies for Emotional and Behavioral Disorders in Children and Adolescents, and I'm just going to be presenting 4 different effective treatment strategies. So moving on, the introduction, I'm just going to explain to you the 2 different types of emotional and behavioral disorders. One are the externalized behaviors, which are antisocial, impulsive, aggressive, and destructive. And the second type is the internalized behaviors, which are which refer to mood disorders such as depression, anxiety disorders, post-traumatic stress disorders, psychiatric disorders such as schizophrenia. So as far as the prevalence is concerned, I just managed to get some statistics. In North America, it's about 17%, and this is from the Board on Children, Youth and Families, 2009. Psychiatric disorders around the world, the prevalence rates are 8.3% for preschoolers, 12.2% pre-adolescents, 15% for adolescents, for all psychiatric disorders. But if you take the average, it comes up to about 11.8% around the world. So around, say, 12%, slightly lower than the prevalence rate in North America. So half or under half of these emotional disorders are prevalent in North America and Western Europe, slightly higher in Eastern Europe, slightly lower in some of these countries, like Italy, Australia, Hong Kong, and China. This is the table, from which I took the 17%. Another statistic that I would just like to point out is substance use disorder, which is about 10.3%. These are the 2 high prevalence rates. The drug sales have skyrocketed. Just want to show you, how the drug sales for anti-anxiety drugs, they were about $6.8 billion in 2010. Again, for bipolar autistic, they have risen to $4.1 billion. And then, of course, ADHD and conduct and learning disorders, $8.1 billion in 2011. Here again, for depressive and anxiety disorders, the drug sales have again, have risen. It has increased to $16.2 billion, and then projected rate is $21.2 billion in 2014, and so also for anti-anxiety drugs, they have increased tremendously, and this table just shows that. Theoretical framework, I'll just quickly go through these 5 theories. I'm sure you're familiar with all these various theories: mentalization theory, intentionality model, attachment theory, the CFIR, and then the theory of reasoned action or behavior. And I'm not going to go into all these theories because you can get the presentation from me if you want, later on, just for lack of time. I'll just go into all these different theories. And then the method for this presentation is just secondary research. I looked up various journal articles, online databases, and statistics, gleaned from the internet. The analysis, I've divided these effective treatment strategies into 4 different parts: CBT, cognitive behavior therapy, family-based programs, psychopharmacological interventions, and then the multisystemic therapy. And I'll just briefly talk about each one of these. CBT, I'm sure you're familiar with. It just refers to a change in thought behavior, and that is change in the behavioral responses, and they are interceded by a change in thought and the way the child thinks. So this is of course done by through self-talk, problem solving, and self-instruction. In conduct disorder especially, you have to deal with the description of the problem, generate alternative solutions, evaluate the alternatives, select the best strategy, and of course, see to what extent this this therapy is successful. And Lockman and Wells, they have proposed the coping power problem, in relation to this, to help in decision making, peer pressure, as well as a way to implement implement discipline, through cognitive behavior therapy. And especially in anxiety disorder and trauma, you find that CBT alters the child's distorted fear-producing cognitions through verbal self-instruction, and it also generates positive self-statements. Also, it alters the trauma and stress again, through positive self-talk. And this therapy is superior to child-centered Rogerian therapy for improving depression and anxiety. The only critique is that, it is only moderately effective, and it is also less effective than other parent-focused and multi-systemic interventions. That is the only critique for this. Moving on to family-based programs, you have two types. One is the parent management training, the other is the functional family therapy. And there are different stages that you have to go through to implement these different strategies. The disadvantages for the functional family therapy is that it's difficult to engage the entire family, and also the lack of trained personnel, especially as far as therapists are concerned. Then you have the psychopharmacological interventions. You have the different medications, and you can just go through it. Ritalin, you may be familiar with some of these medications for conduct disorder and ADHD, Ritalin, and then you have Zoloft, Xanax, SSRIs. SSRIs just stands for selective serotonin reuptake inhibitors, and then you have for eating disorder. Some of these medications, they overlap for the various disorders. Autism, which we had an elaborate presentation this morning. Abilify is one, and then you have Zoloft. These are some of the common medications. But the one thing you have to remember is that these medications you have to always use in combination with other psychosocial treatments. You cannot use them in isolation. And then, of course, the multi-systemic therapy is the most effective approach, because it involves not only the cognitive aspect or the mind, but also other groups, that are connected, with the child. That is family functional therapy, as well as pharmacological interventions, and then, of course, it includes peers, the school, and the neighborhood. And at the school level, of course, the teachers, they have a very important role in implementing, the therapeutic process, and they work along with the parents, and of course they work, they are involved in every aspect of the educational process. Two examples of the multi-systemic therapy are Fast Track and Lift. And the Fast Track involves long-term, multi-component, and multi-site interventions. It's both universal and selective. Universal because it involves all the children, and then, of course, it is exposed. It promotes alternative thinking strategies. It's worked into the curriculum in the school, and also it consists of emotional understanding and communication skills, friendship skills, self-control, and social problem-solving skills training. And of course, it also treats the high-risk groups. And then, of course, after assessment of the change, after 1 year, this program, in this program, it was found, that there was a significant improvement in the intervention group. And then, of course, you have the LIFT program. It links the interests of family and teachers. It works at the elementary school level, and also, this program has been really proved to be very effective. And after this program was put into use, it was found, that there was a delay, in the first-time use of alcohol, marijuana, as well as police arrest. So, in conclusion, I just want to say that no one form of treatment is the right one for any of the emotional and behavioral disorders, a combination of one, two, or all of the intervention strategies may be applied to individual cases. And what is important is that a balanced judgment, must be used in selecting any of the intervention strategy for every case or situation. So, and that's the end of my presentation.